subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. H Suresh. Dr. Suresh is a veteran physician based in Bangalore, practicing for over 5 decades. He did his MBBS from the Bangalore Medical College and Research Institute way back in 1967, and he is a member of the Karnataka Medical Council. It also gives us great pleasure to have him here because he is a member of the Seniors Today family. He has also participated in the Seniors Have Talent event in the not so distant past. And apart from being a veteran physician, he also enjoys his singing. I was speaking with him a few days back, and he mentioned, because he has practiced for over 50 years, and there are families where there have been 5 generations who have been his patients. So we thought of having him here because once again the fear of the third wave is looming large. We've had a few cases here and there about what has been reported, and there was some scare from Kerala that has come in, and even in cities like Mumbai and Delhi and Bangalore, the scare still looms large. So delighted to have you here with us, Dr. Suresh.
Thank you, sir.
My first question to you, since we are going to be talking about COVID care, is how serious is this threat of the third wave? You are you are in the front line, so to say, and you have people coming to you, and you've treated several cases in the last year. So
yes.
So what, according to you, is the reality?
The fact remains, the third wave probably is something like, are we inviting the third wave? Are we inviting the third wave? After the relaxing the rules for COVID, lockdowns and things like that, people somehow have forgotten, or they feel that COVID is gone. It is not. It is very much there. And another wave, another variant may come. We have to continue to be careful, wearing masks and whatever the protocols that have been mentioned, washing hands, distancing, all that. Very necessary if you have to prevent the third wave. I don't know, it all depends on people. Everybody is saying that you have to be careful, but people are going about as if there is no COVID. That is the wrong thing.
But Doctor, while masks is fine, the question is that if you're for a long time in the lockdown, especially in the first lockdown, one was not getting, there was no interaction with domestic help, especially the casual domestic help, and various sales folk, and one was not going to shops. But obviously people have started doing that, and there are people who are also going to their workplaces, and some of them are also using public transport or Ubers or rickshaws or whatever. So what, apart from masks and hand hygiene and social distancing, should one do to ensure that one keeps the virus at bay?
The most important thing is to take vaccines. Take vaccines whenever it's their turn. Do not hesitate, as they say. Yes, vaccines are definitely very, very helpful. And those who have had vaccines in them, their deaths are almost nil. Almost nil. It's very important that all of us should take vaccine. And I hope everybody will be vaccinated, because there's some shortage of supply and things like that, which is not. But I would say that everybody, whenever they get a chance, they have to take vaccines. That is one of the most, or probably the best way to prevent further spread.
But as you said, there is a shortage, and the fact of the matter is that one keeps trying the website and you don't get a turn. And this is all right in cities like Bangalore and Delhi and Mumbai. We may still be able to do what in the hinterland. It's easier said than done, because it's not. It is very, very difficult to get the vaccination.
Yeah, vaccination, correct. Yeah, you feel sorry for those people who are not tech savvy, because you have to book for vaccines too online, which are very well known. The people in rural areas and other places where they may not be so tech savvy, they may find it very difficult to book for it and get a slot. That is one drawback which I see. And these people who are not vaccinated, if they move about like what you said, public transport, whether it's an auto or a bus or whatever it is, and if they are carriers, then the risk is high for other.
Right. We have a question. Those of you who have questions, please put them in the Q&A tab or in the chat window, and we will put it forth to Dr. Suresh. We have a question from Dami Santa Maria, who asks, Doctor, do you ever think that COVID will leave us? Do you think that COVID will ever leave us?
Yeah, I do think it will leave us, because many diseases have come and they have gone. But each one takes its own time. And probably this being a virus which is mutating every now and then, as we see, it may take a little longer. Then it is natural for every human being to develop antibodies. So slowly over a period of time, all of us will have antibodies. It may take a little longer time, maybe another year, by which I think things should be much, much better. As it is, the number of deaths have come down. Vaccinations are being given, though there have been little difficulties in getting the vaccines. I think the herd immunity, as we call it, not everybody is hospitalized. See, remember, not everybody is suffering very seriously or is being hospitalized. There are people who are very mild attacks and they stay at home and get better. So naturally, we know that once we know that this is the case, that all are not going to die, and we are sure for a period of time, herd immunity will come into, and then we will definitely work. It may be just a matter of time.
Right. Doctor, we have a question from an anonymous attendee who asks, how will I know if I was successfully vaccinated and that it has produced the desired results? Do I take an antibody test? After how many days should I take an antibody test?
Yes, good question. After the second vaccine, you have to give a period of at least 4 weeks. At least 4 weeks after the second vaccine. Minimum of 4 weeks, but then it's better to go for a little later and check out on the antibodies.
So the question is, what should be the antibody count? He says that a friend of mine took an antibody test for himself and his wife, and they had taken the jabs, both the jabs on the same day at around the same time. And one of them had this count as 91 and the other one had a count of 150. So what should be the ideal count? The normal range given is 80.
Yes, correct. From my viewpoint, it is too soon to lay down this kind of a criteria because of certain factors. Some individuals produce antibodies faster than some others. Then those who have comorbidities will produce antibodies slightly slower. We are actually thinking of a third booster dose. It has been recommended that it's better to take a third dose, probably after 6 months. So people who have antibodies of even 80 or something, it's preferable that they take a third dose if and when available. But otherwise, more or less, we would have antibodies due to the jab and the going. You will also have antibodies due to, what shall I say, by natural sources. That is due to herd immunity, natural sources. Fine. they have recommended that dose of, the reading for antibodies. But anything near that is very fine, not an issue. But what studies that have been done, see, we have not got very definite studies in many areas. What studies that have been done proves that the vaccines are providing enough antibodies for all sections of people, and it is fine that it wards off the serious consequences of the disease.
Doctor, this entire controversy about the number of weeks that the two jabs should be, the number of weeks that should be there between the two jabs has been raging. Now, we have received 3 questions on this, and the question is that if one has taken the second jab before the 12 weeks that is now being advised, is there any possible problem that one could have in terms of the efficacy of the second jab and the immunity that is built up?
No, actually, jabs of covaxin are said to be given 6 to 8 weeks apart, while Covishield can be taken up to 16 weeks apart. This is a thing that is being studied, and there will be no ill effects. There will be no ill effects if the jab is taken slightly earlier also. But by itself, the non-availability of the vaccine is one factor which will even put a Covaxin, which should be taken about 4 to 8 weeks, will also not be given in that period. It will take a longer time because of the availability. But no additional reaction will be there. Some people, all vaccines have certain amount of reactions, which is very local, pain, swelling, slightly feverish feeling. Some don't have anything at all. I took the jab, I never had any reaction. I went to work. So you can't say. My wife took the jab, but then she had a lot of pain and all that. She was feeling feverish and things like that. Different people show different reactions. But 4 to 6 weeks for Covaxin and Covishield, they are always postponing up to the 16 weeks easily. Another thing I read, I don't know how it is, but then there's another vaccine that I came across, which is there. Sputnik vaccine from Russia,
right,
which now I think is being manufactured in Dr. Reddy's lab. Now he says this outshines both Covaxin and Covishield with 91% efficacy. So there again is another good point. Only 2 jabs of Sputnik, you will have 91% of efficacy. Is very good, very, very good.
So, doctor, if one does go to the CoWIN app now, you also get options of the 3 vaccines, right? You have Covishield, Covaxin, and Sputnik. So which one should one choose if you have all 3 available?
Sir, if all 3 are available, what we have, okay, this is a good question with good statistics. People who have received Covishield have not shown so many of unnecessary reactions. Yes, they have had pain, fever, feverish feeling, or things like that. Covaxin also has mild reactions. None of them have shown very severe reactions. But then as far as Sputnik is concerned, still in infant stage. So we have to wait to see if that has any side effects. Only then we can probably definitely say this is the best. But as far as statistics are concerned, Covishield and Covaxin, they have arrived at the conclusion that both are very similar, equally effective.
Right. We have a question which is also asked by Mr. Santa Maria, who says, we are told over and over again that people who take the vaccine get COVID and they're lucky if they survive. Is this true? Is this true that people who take the vaccine, I know you've said this already, but there's obviously a lot of talk about the fact that, well, yes, and this anti-vaxxers keeps talking about how the vaccine is not effective. So what's the point of taking it, etc., etc. How was it possible to have a vaccine ready when this disease has been there just for, for just a year after the disease was discovered, the vaccine was formulated and in the market?
Yes. See, it is, there is a point there. She is right in asking, but people, the medical fraternity is not performing post-mortem studies. People have died, but we do not know, and it has not been proven that it is due to vaccines or COVID infection after the vaccines. It could be comorbidity, which is what they claim, but we have nothing to prove that it is due to that because post-mortem studies are not. The ICMR and all that, they have actually not made a protocol of how to conduct a post-mortem for a patient who has died of COVID. It's a little difficult to say. And I'm sure if you refer anywhere, 99.9% of people who have had fever after COVID vaccines, the question is that after COVID vaccine, there have been no deaths as such, other than, for example, due to old age, due to heart attacks, or due to other predisposing conditions like diabetes.
Doctor, we have a question from Rajnikant Gilani, who asks, is it okay to take a third booster dose? How would it work? Any suggestions?
No, it's like any other booster dose we give for children. We have been giving primary dose, second dose, and the booster dose also in many cases. In fact, in influenza vaccine and all that, pneumococcal vaccine, we just give once a year because the antibodies last only a year. In this case, what is mentioned is that after the second dose, the booster dose after 6 months gives you long-term immunity. Long-term immunity. No harmful effects.
Right. Doctor, there's a question which has come in. He says, why is the medical fraternity so divided on the vaccination? And not only the medical fraternity, but even the pharma companies seem to be differing in their views, not just in India, but elsewhere in the world also. So is this all trial and error, or is this, do we need to keep getting ready for newer research and newer theories?
Nice question. Research never ends. In medical field, you will always notice something new is continuously going on and on and on. So R&D is always going on. The thing is the question as is asked, you can't say why it is divided, simply because there are different types of vaccines which are approved by different governments for their use. Now, before taking the vaccine, has there been a study on the kind of individual and things like the standard thing? And after taking a vaccine, whether they are comparing those results, and then for a large number of, for a large population, are they comparing? It's very difficult because first thing is this disease is only 1.5 years old. So there, in between, what had happened? Everybody claimed to have a treatment. Everybody claimed to know this. Everybody claimed, they said, put some drops here, do this thing, do that thing, warm water. You must have gone through. Everybody has heard about it. The people are advocating a lot of house remedies and stuff like that. Now there are people who claim from other branches of medicine that they have a cure for it. Are all prepared to take that and not take vaccine? No. They are not saying that. There is something here because it's homeopathy, Ayurvedic or whatever. I'll take only that and not take vaccine. I don't think so. People are not prepared to experiment upon themselves. Second, the study is so soon to come to a conclusion. whether this vaccine is better or that vaccine is better, simply because, now take for example in India. India has had the second largest amount of cases. United States was one. India has had the second largest number of cases. And these people are administering both vaccines. Who is going to come? Do patients, after receiving the vaccines, are they going back to help the R&D? No. They're happy I've got the vaccine, they're happy. So efficacy, as far as whatever study is available, both are very similar, both are very effective, giving the same or almost the same amount of immunity, and both have very similar side effects. Only thing is newer ones that are coming out like Johnson and Johnson and Moderna and all that, it's not used widely here for us to make any comment.
Doctor, we have a question, and this is about the precautions that need to be taken. We've heard doctors tell us that we should be careful if we have fever. In fact, even if we have the slightest amount of fever, we must be careful and isolate ourselves. I have been having a cold since the last couple of days. Now, can that be possible infection of the virus?
The vaccine, are you meaning that?
No. If I have a cold for the last 2 days, could that be a possible virus infection?
Virus infection. Good. See, I have treated a lot of cases online in the months of April and May, where there's a very, very huge number of cases. I've treated them online. My method has been like this. And I've been, by the grace of God, I've been very lucky, and I've not lost anybody. They've been successful. Very humbly, I say that I have been, God has been with me, and I've treated people all across, not only in Bangalore, believe me, sons or daughters who are staying in Bangalore, working in IT sectors, have their parents and other relatives in different parts of India, and they have referred me to their parents. Like, Bhopal, Secunderabad, Tamil Nadu, and all these places, I've treated them, Orissa too. Now, this thing is, am I audible?
Yes. Sorry, I went off.
No, it's okay. It's okay. See, the thing is, how I did is what I can share with you. Whenever anybody comes with a simple cold or cough or a throat irritation, slight fever and all that, the first thing during an epidemic or pandemic, the first thing is you suspect first. Is this COVID infection? I used to ask them to get an RT-PCR test done. Most of the RT-PCRs, are very correct. Some may be, negative, though if the patient is positive on a particular day. If they have cough, you put them on simple medicines for the first 1 or 2 days. But if the cough persists, even if the fever comes down, if the cough persists, patient is feeling very weak, or that small temperature, you get a scan of the chest, what we call HRCT, high resolution CT, get it done. Now, they have developed a method of giving the report on one of the ratings. They check, they do a scan of the chest, and they find each segment of the lung, they see, and then they report. And they give marks, like so much out of 25. So that is very important. If the patients are in the group, from 0 to 25, but then even patients with 8, 6, 10, 12 maximum, they, when treated, early with antivirals, steroids, blood thinners, supportive treatment, I find they all recover. Most or almost all will recover. Only very few that may go in for serious illness, that they may have to be admitted, and then that's what it's an institutional care. But I don't don't think one should delay in starting the treatment the moment they suspect. That is what.
So, in fact, doctor, there's a counter question to this, which is that so should one contact a family doctor even if one has a slight cold? Earlier, one wouldn't want to do that. One didn't have to do that.
If you don't want to go physically to a doctor, if the doctor is available online or his number is known, they could at least call him. Because if they fear that some other COVID positive patient is coming to consult a doctor and you may not be positive, so sitting with him in the waiting room or whatever it is, and are likely to get that COVID to themselves. No, possibilities are there, right? So at least let them contact on online. Day-to-day follow-up is necessary. Day-to-day follow-up. But the thing is, if one thinks, oh, I just have a little cold and cough, why worry, it is not COVID, that is the wrong idea. I think that's the wrong idea. At least day 2, they should become careful.
Right. Thank you. We have another question which is about the drug ivermectin. It has done a lot of good the world over. Your opinion instead of a vaccination? And what about nasal sprays?
Ivermectin has been discontinued. Basically, even in the very beginning, I used to think how ivermectin will help, because that is a medicine used for worms, treatment of worms, intestinal worms. So always I thought, well, how is it that this is going to help? Now anyway, they have discontinued this ivermectin. No more in the picture. Even HCQS is no more in the picture. Basically, it's antiviral, steroid, blood thinners, anything else will be support kind of thing. Oxygen and monitoring oxygen concentrations, breathing exercises. These are very important. They help along with.
Right. Thank you. We have a question from Mr. Raghavendra Odia, who says, I'm 74. I have taken 2 jabs. After taking the jab, I didn't get any fever or body ache, while some of my family members did get it. Does this mean the jab had not produced antibodies in me?
Good question. Actually, this fever or the swelling and the pain is what we call an antigen-antibody reaction. Some people whose production of antibodies is a little less because of age or any comorbid conditions, the production of antibodies will be slow. And when it is slow, your reaction also will not be immediate. Others who have got good health and they have enough antibodies very fast, so they have fever, redness, and such side effects. Whereas these people will be, shall I say, slow to react. Slow to react. That's all. That's the reason why he didn't have anything else.
So, doctor, the question is, so should one keep taking antibody tests every now and then to check what the antibody count is?
If one is very particular, one can do it, but may not be necessary for everybody to go and get the antibody, because by now, as I told you, people would have developed antibodies. After the jab, there's definitely the antibody, whether it is immediate or slow. They will develop antibodies. They will have immunity. So it's not necessary to go and check it. Then life will go on. You see, we had H1N1. People were dying of H1N1. Then Ebola came. Then diseases coming and going. And every time nobody can run and then get an antibody, because this has been a pandemic and a lot of people suffering, and death is very fearful. Because of that. What has happened is that after the jabs, people are a little paranoid, some to find out whether this can help. I should not go into that. But really, simply put, everybody develops antibodies. The quantum of antibodies produced may vary with different individuals with different conditions. So one need not worry and go and check the antibody. One is very particular or scared, then he can go and get it. And in case when you have ample shots, jabs available, and the antibody is probably less in those, we can get a booster dose.
Doctor, we've had this question asked several times earlier, and I'm sure even you have been, but the question is, are surfaces safe? If something is delivered to us at home, do we need to get it washed or just leave it as is? Should one have to wait for 48 hours as one had to wait earlier?
Could you kindly repeat the question? First off, I didn't get it.
The question is that do we need to take care of surfaces when certain things are delivered to us at home?
Oh, yes. Good question. It depends on the level of thinking. Also, some are very paranoid, but on the safer side, to talk about it on the safer side, yes, whatever you get from outside, whether it's food, vegetables, or whatever it is, or any other things. Amazon is delivering so many of the packets, and so a lot of people are getting to that. It's better to spray, leave it there for some time. The surface upon which it is sprayed would be either sanitized or let dry and wipe it, with soap and water or whatever it is. So it depends on where you have kept it. And is that surface being used repeatedly? Like, if it's a small table or something, if children will go put their hands on it or something like that. So those things one has to, it's totally individual, but they can be careful. A lot of people, have different ways of cleaning vegetables that they buy. Whatever is delivered to their house, they keep there for about 24 hours, thinking that the virus will go. How has it been proven that? Has it been proven that once you keep something on a particular surface, and whether this packet is safe to be handled after 24 hours or nothing? So therefore, better they do sanitization.
Right. We have a question from Colonel Dugal, who says, I've been taking HCQ 400 for a number of years. Is this medicine a treatment for COVID? I'm 77 and have taken my jabs. I have no signs of any kind.
Okay. Right. Basically, HCQS has been used in the treatment of rheumatoid arthritis, joint pains. Joint pains of a different kind. That's called rheumatoid arthritis, an autoimmune disease. And they have been using that for years. Now, it has been disproved now. In America and all that, they wanted a large supply of HCQS from India at one time. But then it's been proven that it's not anyway effective towards COVID. If he has got the joint pains, if this question, gentleman in the question is suffering from rheumatoid arthritis or something like that, body arthritis, he may take, but it's better not to take continuously. Only if there is pain for a couple of days he takes, that's enough. Taking any medicine for a long period of time is not advised. Another thing is, HCQS is in no way helpful in the treatment of COVID.
Right. Doctor, there is a question from, I want to stay anonymous. Doctor, my son and daughter-in-law have been asked to attend work. Do you think it is safe for people to go to work? Because offices have air-conditioned environments, and however much you might try to keep a social distance, there will be meetings and there will be occasions when the distance may not be maintained.
This question probably is self-explanatory in the way. But we all know the social distancing is being asked by all people, expected by all women from all people. That is one thing. Inevitable, go to work, so you should observe this, norms. Okay. When you sit in the car or you go by public transport or auto, you have to keep your hands sanitized, you go touch anything. Yes, we are in such a, shall I say, scared state of mind. Whatever we touch, you think you have to sanitize, you have to wash your hands and things like that. But if it's inevitable that one has to go to workplace and all, we have to observe some bit of care. Either they wear gloves and dispose the gloves. Well, it's fair enough. Use sanitizers, keep distance. Beyond that, what else can you do? Children, that's why schools are not reopened. It's very difficult in such a state. I don't know what the gentleman expects from me. I don't know.
So, Doctor, I know uh, we are well close to our end time, but what are your overall what is your overall advice for people to ensure that they don't get hit by the third wave?
Don't get?
We don't get hit by the third wave.
Yeah.
I know you've mentioned having taken the vaccination. You have also mentioned about social distancing, and you also mentioned about masking up.
Yes.
But apart from that, is there anything else that you would recommend that one needs to maintain on a typical day-to-day basis at one's home?
Personal hygiene. Then another thing is you will see a lot of, I don't know, I find this auto rickshaw drivers or this thing, they keep spitting all the time, which is not a good thing. They should also become conscious that they may be spreading a problem. They may be, what you call, carriers, but they should not be spreading this problem. Small hygienic ways are very necessary. But then the best thing is vaccines. Prevention vaccines.
So the question is, why is an AC not advisable for COVID patients? And there's another question, if one wants to use private transport, which one hires like a rickshaw, what is better to take? Is an auto rickshaw which is open, or is it better to take an Uber or Ola?
See, auto carries a lot more number of people than Uber. Whether it's auto or Uber or whatever, they have to, at least the drivers must take care that they sanitize the seat and the back and the rod every time there's a passenger. This involves money, so naturally, I don't know how they will think. They say, we're not having customers, and how can we maintain that? That question is possible, and I understand that. So the best thing is that if you're going to sit in an auto, be careful, sanitize your hand, don't hold the rod, don't hold anywhere. While climbing stairs, don't hold the railing if you can. But I foresee people who are little aged, they may require the hold the railing. All these things, seats, I don't know, unless the auto rickshaw is able to sanitize or something like that. Even Uber, it stands the same for both of them. Whether you travel by an Uber or auto. Auto probably, if it's a single person travel, at least is relatively safe. Relatively safe. But if it's traveling or sharing, with an Uber or whatever is Ola or Uber, then you don't know. Isn't it?
Right.
Am I right? Am I right?
Yeah. Doctor, we have a question about sanitizers, since you just mentioned that. We have been using sanitizers for the last 1.5 years nearly. Are these safe for the skin? Could I get rashes or anything else? We don't really know with sanitizer to use, because a lot of them are available in the market. What is your advice?
Good question. See, I have found a lot of people having some small problems with the skin and arm. First thing is itching. Some people may develop itching and redness. Most people develop dryness from the ethanol or whatever it is there. After you put on sanitizer, it evaporates. As it evaporates, it may take away a little moisture from your skin. And once it dries up, the skin dries up naturally because the moisture is taken. And if you're repeatedly sanitizing, like a person working in a hospital or something like that, similarly where they have to sanitize their hands all the time, they may find these problems more than once in a way users. Suppose you are using your own vehicle and you're using a glove. And so if you're going by car, fine, you have a sanitizer in the car, you just sanitize, you don't do. And if it's a two-wheeler, he will be better, he uses a glove And then whenever he has to take off the gloves and throw it. Okay. That's what it is. But repeated sanitizing with different what I call sanitizers that are being used. I don't know. See, basically, I won't go into that because it all depends on the concentration of the present of the ethanol and other things present in the sanitizer. Some sanitizers are so bad. Believe me, I got a shock. My sanitizer, I got this sanitizer this was about a couple of months ago, supplied by a pharmaceutical company. And the patient told me, I was still using my own sanitizer all the time. The patient told me, doctor, I think the sanitizer has got something. Is it right? It makes my palms warm, hot. I said, how could it be? And I said, okay. The next patient came in, also complained. I said, no, I must go and check. So I went and checked myself. Yes, I think there was something which is stronger, uncalled for, and it will go in your hands. That sanitizer was to be used continuously. I am sure people would have a lot of rashes, the skin peeling off, the external surface of skin becoming rough and all that. Yes, it would have resulted in that. And then naturally you have to give all these creams and things like that, moisturizing for it to become normal. It can be avoided by checking the level of ethanol or whatever, whichever sanitizer we use, first try it. First try it if it is very kind to your skin. If it is not, then I think one should be careful.
Right. Doctor, I was going to end it with this question, but there's an interesting question that has come in. It has been asked to various people in the past, but I'm going to ask you also. Do you advise Ayurvedic immunity kits that are available like Patanjali or Sri Ravi Shankar's? This is the question which is asked by Mr. Raghavendra Odiar. And the fact of the matter is that there have been a lot of kadhas and potions that have been advised. There have been also reports that they could damage the liver. So what is your view about these various immunity inducing potions?
Different forms of medicine, that is different forms of medicine that you use.
Right.
So the first thing is, I generally, even in my clinic, I generally don't pass a comment on things I do not know. First and foremost. Yes, you may call it playing it safe. It's not playing it safe. I respect each one in their own place. I respect each one else, whatever form of medicine and treatment in their own place. But yes, in the recent times, a lot of things have come out. A lot of things have come out. People have said, take this and take that. And now, as far as older medicine and older methods are concerned, it's away from whatever we have been talking on medicine. Turmeric, pepper, ginger, all these things have been, at least labeled as very immunity building. They build immunity, and they have been in our usage in India in plenty for centuries. But taking COVID situation as such, are you prepared to wait? I have had patients, that's why I said I'm not, it may be good, it is good, but to what extent, I'm not able to say. Let me not. But I can tell you this experience. See, because I told you I treated more than 150 patients of COVID online during April and May alone. So I can tell you that people who have told me, no doctor, I don't want to take this, I don't want to take that, I will take this kind of medicine or different like Ayurvedic, whatever, whatever you have mentioned. Fine. So I will take it. They have gone. Hardly 3-4 days, even less than a week, the family has called me up and said, this man is coughing and coughing his lungs out. Oh, the situation is a little serious. I said, okay, get this thing, what you call CT of the chest, or HRCT, and the score was quite high, 18 out of 25. The 18 out of 25 is more than half of 25. Actually, what would I advise? I would advise better you get admitted because treatment at home may or may not be successful. Such cases do happen. Happen. Risk is theirs. The risk is there. You see, everybody likes to be away from the English medicines because they say that it has got a lot of side effects. Now, what doesn't have side effects? Everything has side effects. It's only something proven or not proven. But it is the individual's decision, the courage that's more important, that they'll either go to different forms of medicine. I have, you see, there have been another thing which is very important. Not all patients with COVID were admitted. Most of them stayed at home, quarantine at home, isolation at home, and have recovered. Some have taken just plain azithromycin and then, Dolo, this Dolo 650 has become a household name now. So they have taken these things and then they have recovered. Probably their immunity was good, the infection was mild. But one cannot just say that all of you have got COVID, just take this. If that was so simple, we wouldn't have had so many deaths.
Doctor, the number of questions that have come in are so major, but I'm going to ask just one last question, which has been asked, and it's an important question, which is by Joe Prakadan, who says, I have taken 2 doses of Covishield. Should the booster dose be of the same vaccine or would it be a different one?
Good. Preferably the same. Because the time you are able to get the 3rd dose, which means you've already taken 2 doses, and there are people waiting in queue for the 1st dose itself. To get the 3rd dose is not so easy. But if you are getting the 3rd dose, please take the same brand.
Right. Though, of course, some of these theories can keep changing. And for that, I guess people need to keep watching and following what we are doing on our Health Live at Seniors Today, because almost every, say, 6 weeks, we do discuss the COVID situation with doctors like yourself. And thank you very much, Dr. Suresh, for having come in on the show on the Health Live at Seniors Today session. Those of you who would like to read the takeaways and the edited video of this session will be on the Seniors Today webinar section on Monday. We will be back once again next Saturday with the Health Live at Seniors Today. And next week, we have a leading orthopedic surgeon talking about hip replacement. That's Dr. Dilip Shah, who's going to be talking about hip replacement for senior citizens. Yes, Dr. Suresh, you have what to say.
Finally, I would like to thank you, sir, Mr. Pradyuman, and Seniors Have Talent team itself for having given me this opportunity to talk to you and share what little I know about my experiences with COVID. And I thank also the patient listeners, and they have something good to suggest to me. Please let them do. I'm very happy to at least either improvise or gain some knowledge from their own experiences. It will be good. But really, I should thank you and your Seniors Have Talent team for being this opportunity. Thank you so much.
Thank you very much, Dr. Suresh. And what we'll also do is, since you mentioned that you have treated so many people online, we will also take from you your contact numbers so that if somebody wants to contact you online, they can do that. And we have in the chat window given the link for the registration for the session on hip replacement next Saturday. So those of you
can add something.
Yeah.
Can I add something? I'll take a few minutes more of yours.
Yeah, sure. Go ahead.
I suffered COVID in September last year. I suffered COVID in September. It was not serious at all. Only thing is my blood counts are a little low, and I was admitted. During my admission, I was observant. I was observing exactly what they were doing and what was the medicine that was being given to me and all that. I photographed everything, and because I worked for so many years, I wanted to look some bit of pick up some knowledge from this. Well, anyway, what I found at the end of it was nothing very great. Yes, they have saved lives, but what about at what cost? I am reading and coming to know that people are paying lakhs for treatment. A common man, simple office goer, how much can he afford, or how many of them can afford to pay lakhs? They have family to run, rents to pay, school fees to pay, transport, everything. Plus this, it will drain them of their savings. And there are lots of stories I have seen because I've been into this. Finally, that is what made me decide if I could help people to battle COVID online. That's why I formulated a way of treatment, which I wrote down and I started using them. I wrote down and then I started using them. And of course, God has been very kind to me, and I have been able to treat so many cases, not only in Bangalore, from outside. In fact, believe me, I'm not seeing the faces of those people because I have not gone into video calls, but I have my WhatsApp has helped me a lot. I wrote it, I photographed, I sent it to them, got the reports, they sent it to me through WhatsApp. Treatments were going on. I'm really very, very happy for all that. Really, that's what I wanted to say. If he wants my help, please refer me. I'll be able to treat them. They need not spend so much money. The whole treatment will be probably anywhere less than 8,000 rupees or max 10,000. Apart from this, I tell them also a follow of what oxygen saturation, recording that and then monitoring it, breathing exercises, protein, extra protein, because let your people on that post-COVID, a lot of people have small problems. They get a lot of muscle pains, extreme weakness, vital capacity comes down. All this is there. I help them out. It's not that I'm honestly telling you, just I felt I have to do something good for people. That's why I did.
Great. Thank you once again, Dr. Suresh, for all the time that you've taken. Thank you very much. And thank you to all our attendees here. We will be back once again next Saturday for our next session of Health Live.
Thank you so much, sir. Thank you.
Thank you very much.